The European markets are much more cutthroat when it comes to cost. That's because it was public funding for a long time. Coffers have been empty a long time ago, so there was much more pressure. But we see this pressure coming to the shores. We see our customers starting to struggle with these pressures. So we as an industry are now trying to see how can we provide value and how can we visualize value that can be expressed in cost at the end of the day. And that's a significant change that we see in our customers that we haven't seen before. But and the third aspect is the technology. And actually this is our way out of the storm or navigating the storm. Because for the first time these things are coming together. Healthcare, IT has been very clunky 30, 40 years ago because the technology wasn't there. So there are a lot of things, whether it's the cost of data storage, the availability of new devices that are going into the hospital where a nurse doesn't have to carry a huge cart around. Those things are now enablers that help us sell the technology to our customer in a way that it hasn't been before. Because our customer base in the hospital has been focused on providing care, and they saw technology in the past mostly as a distractor. And I think one of the comments I saw that were submitted are indicating that people feel when technology comes into their hospital, it slows them down and does not make them more agile and doesn't improve the quality. So that's something that we're working to address, and technology is going to help us now more than ever. So I'm actually very, very hopeful, and I'm very glad that I came into this industry now, because we can change as much now that we could ever change before. The meaningful use for those of you, and unfortunately it's a little bit bright on the screen, is a government initiative that was put out to mostly focus around 5 areas: to increase the quality of care, to engage the patient and families, because nothing is more important for us as a patient than having our lab results, having our information right there, not waiting over the weekend or a phone call. So having that interaction. To improve the care coordination, because this is one of the stumbling blocks across healthcare, because healthcare is so decentralized. We sometimes believe in the industry that healthcare revolves around the hospital, but we will see with accountable care that the span of healthcare is much bigger. And shame sometimes on us for ignoring that. Then healthcare starts way outside of the hospital, and it also ends way outside of the hospital and the post-care. So that's something that the government realized, that they say we have to look at it holistically. We want to set some parameters outside to make that. And then, of course, as being the government, they want to improve the overall health of the population, which is, of course, a genuine goal of any government, so they're trying to shed more visibility on that. But also, as an overall umbrella, ensure the privacy and security, because our healthcare record, much more even than our Facebook account, is near and dear to our hearts, and this is something that we don't want to float out there. There's a lot of security concerns that each of us have on our record, and how do we enable both the flexibility and the access that a physician needs in the case of emergency, with the protection that the individual needs to not have someone access it. And this is a paradigm. Those two things seem to be diametrically opposed, but this is also something that we're working to solve and to make easier. Because again, if you have an emergency, the last thing you want to do is work with cards and still put in passwords and those kind of things. So the meaningful use is done in 3 stages. As I said, we have the incentives stage that is now in full steam, and in 2014 we're going to have the first penalty phase, and this is going to be the interesting one, because some of the